A systematic review of outcomes associated with patients admitted to hospital with emergency haematuria. Unscheduled admission for haematuria accounts for 15% of all urological emergencies, with over 25,000 patients admitted each year in the UK. It is associated with prolonged admission and poor clinical outcomes, and management is often complicated by comorbidities and antithrombotic drugs. This study aims to determine the current management strategies and outcomes in patients admitted to hospital with emergency haematuria. To do this, a systematic review was performed for randomized controlled trials and retrospective and prospective observational studies, assessing the management of patients admitted as an emergency with haematuria. The primary outcome measure was the length of stay. Secondary outcomes included hospital readmission, mortality, and health resource use. The data was pooled for studies reporting the primary outcome. Other articles that did not meet the primary outcome but included relevant secondary outcomes were also included and reported separately. Data was collected on study characteristics, patient-related factors such as age, gender, and concomitant comorbidities, and disease-related factors and intervention-related data extracted such as investigations and management. Only 3 eligible studies were identified with a total of 219 patients. The mean length of stay was 5.8 days, and 45% of patients were taking antithrombotic therapy. 61% of patients had inpatient imaging scans, which may reflect missed opportunities to expedite diagnosis or treatment during the inpatient stay. A further 9 articles did not meet the primary outcome, but included relevant secondary outcomes. To conclude, unscheduled haematuria admissions represent a significant challenge in urological practice. Despite the frequency of this presentation, there is a lack of high-quality evidence to guide best practice. The limited data suggest a prolonged length of stay and variable use of diagnostic imaging and interventions. These findings emphasize the need for further prospective studies and the development of standardized management protocols to improve outcomes and resource use in this common urological emergency. WASHOUT by the British urology researchers in surgical training aims to be the largest prospective international multi-centre observational study to assess the impact of varying management protocols. Join over 350 sites taking part in the largest data collection on unscheduled haematuria admissions.